Buenas tardes and good afternoon, everyone. Welcome to our Latinx Health, Mind, Body, and Soul Charla in partnership with AARP to impact our community through salud, dinero, y amor. I have my salud until further notice. I don't have much dinero, but I've got lots of amor. So thank you, everyone, for being here. This is a very special and important charla. For us as a community, we are impacted by certain physical and mental health concerns at disproportionate rates compared to people of other backgrounds. My mentor, my boss for life, Dr. Pedro Jose Greer, who will be speaking in a few minutes, says that 85 to 90% of diseases are non-biological, but based on social determinants, including your zip code. Some of these discrepancies stem from poor health outcomes and economic disparities, which is the point he's always trying to make. This charla will feature experts and community members who will share their resources and personal stories on how to take care of yourselves, your loved ones, and let's not forget taking care of those around us, which are also part of our responsibility. Before we get started, I'd like to go over a couple of housekeeping items. Please use the chat box to ask questions, raise concerns, or just give us energy. Ensure that it's set to all audience. It defaults to panelists, but we want to make sure that everyone can see your comments and questions. We'll also try to answer questions throughout the charla in the chat and the Q&A window. We'll follow up via email and include all the resources that are shared today. So let's get started. Thank you again for joining. Thank you to the charla oradores for sharing their perspectives, experiences, ideas, and inspiration. First, I want to welcome Veronica Bedon, Senior Audience Manager, Hispanic/Latino Strategy for AARP. It is great to have you join us, Veronica.
Good afternoon, everyone. My name is Veronica Segovia Bedon, and I work in the Office of Diversity, Equity, and Inclusion at AARP. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering people 50 plus to choose how they live as they age. Like the Hispanic Heritage Foundation, AARP is a strong advocate working to ensure that we all have the opportunities and resources to care for our mind, body, and soul. Studies show that mental well-being can impact our brain health as we age. Therefore, whether it's working to maintain an active lifestyle or looking for ways to learn new things, taking the steps to prioritize our mental wellness is imperative. And by tuning in today, we are already taking those steps to a healthier us. Our teams at AARP know how important mental well-being is. And because of this, we created AARP Staying Sharp, an award-winning digital program that offers content about brain health, including fitness and health information. Additionally, it provides users with tools and resources to take control of their brain health by following 6 key pillars. We talk about being social, engaging our brain and learning new things, managing stress, getting exercise, restorative sleep, and eating well. In celebration of Brain Health Awareness Month, AARP Staying Sharp members can take cognitive assessments and lifestyle check-ins the entire month of June for free. I encourage and invite all of you to visit stayingsharp.org/free to take advantage of the resource. And for those of you joining us who are caregivers or might become caregivers soon, we know it's easy to forget about your own needs. But remember, you must take care of yourself so you can truly take care of others. And at AARP, we know that caring for a family member or a friend is a huge labor of love, and it isn't an easy task. That's why we've also created guides to help you navigate the caregiving process and develop a healthy balance between caring for a loved one and the other roles you play in your day-to-day life. You can find these along with many more resources in English and in Spanish at aarp.org/caregiving or aarp.org/cuidar. And I want to take a second of personal privilege to acknowledge that mental health and self-care can be difficult for us to talk about or even ask for help in certain circles. I myself have struggled with disordered eating most of my life, postpartum depression, and anxiety. A little over 7 years ago, I was introduced to mindfulness and meditation. I also talked to a therapist. I am grateful for the access to these tools as I navigate parenting, marriage, relationships, and yes, the demands of stressful work. I'm especially thankful to those experts joining us today and those of you who are on to share your personal stories and challenges. As a community, we may have a lot of work ahead of us to reduce stigma around the topic of mental health, but it is our experiences that make us who we are. And in case no one has told you today, you matter, you are enough as you are, you bring gifts to this world that are unique to you and that no one else has. These sessions are so powerful because our personal storytelling offers connection, and how we talk about ourselves impacts how the world sees us. In my role, I aim to generate awareness about AARP, connecting you and your family to helpful tools and resources. And I want you to remember to make sure to take care of your mind, body, and soul. Gracias, and enjoy the charla, everyone. Tony, back to you.
Thank you so much, Veronica and AARP, for supporting such an important charla and creating this much-needed space, como siempre. Up next, we have my jefe, my role model in life, my compassionate compass in doing this work. He is a true leader through advocacy and action in developing a more inclusive, community-centric culture of health in the United States, Dr. Pedro Jose Greer. Dr. Joe has been an indefatigable advocate for health equity by engaging communities to create effective health and social policies and accessible healthcare systems. He established Camilla's Health Concern and St. John Bosco Health Centers for underserved populations in the Miami-Dade, Florida area. He was known for years as a doctor for the homeless and appeared in my own kids' textbooks. So it was of great pride when I told them that they've actually had dinner with him and have met Dr. Greer. He has received numerous recognitions for his work, including the Presidential Medal of Freedom from President Obama, which is the highest honor a citizen can get. In 1997, he got the Presidential Service Award by President Clinton and the MacArthur Genius Award. He also got the Lifetime Achievement Award from AARP, along with Maya Angelou and other iconic leaders. So it's gone full circle. And oh yeah, he also got our organization's Hispanic Heritage Award way before that ceremony was on national television at the prestigious Kennedy Center. He says that it was at a salad center or something. Joe is also the reason I got this job, leading the Hispanic Heritage Foundation more than 21 years ago. He was the incoming chair of HHF, and despite a lot of opposition, he ended up hiring me anyway. And more than hiring me, Joe always believed in me. I've always said that my two greatest motivators in life are when somebody believes in me or when someone doesn't believe in me. They work just as well, but I prefer the former. And Dr. Joe has always believed in me, and that has meant everything to me. Thank you for joining us, Joe. You always make time, and spending time, actually, I appreciate more than anything, spending time chatting with two of our lofties that are still in their teens and are at Johns Hopkins. One's on his way, and the other one is there, and they will carry on the legacy of taking care of our community and beyond. So let's hear from Dr. Joe Greer.
Tony, thank you very much. And I want everybody to know that my mother wrote that. So thank you for those kind words. Tony, you're a superstar, and you actually do more for the health of our community than I do or my profession does. It's quite hubris of the academic profession of medicine to talk about health equity when we don't have equity in the profession. Let's talk about that first, and then we can see the basis of what the problems are. Academic medicine and medicine within itself is racist, sexist, xenophobic, and elitist. Besides that, we lack certain virtues: humility, empathy, compassion, all of the things that are so important, and especially with the Hispanic community. The way they revere a doctor, the way they address a doctor, it's incumbent upon us as professionals to turn around and do it the right way. Mental health is the number one public health problem in this country right now, and we are not addressing it. We're seeing it both with mental health issues that can extend all the way to suicide, which is about 70% of gun deaths, by the way. Substance abuse, the increasing numbers of people dying from alcoholic liver disease. So when you look at all these different things and you see the morbidity and mortality has continually gotten worse in this country from 2017 on, this year we have the worst morbidity and mortality of any industrialized nation. So within sitting in a country that has some of the worst outcomes of any wealthy nation, and in that matter for about 40 nations. And when Hispanics rank worse than the country, we're looking at almost third world statistics, and we're not doing anything to resolve it. 85 to 90% of all causes of diseases have nothing to do with your genetic code. It starts off with your zip code. We saw this during COVID. What were the two communities we ignored? Hispanic and African American. In the southwestern United States, in the West, the Hispanics suffered more than any other group from COVID, from either death or disease. And nobody looked at the fact that maybe they don't trust the profession. Maybe my profession is not doing what it needs to do to get out there. When 5% of American medical students are Hispanic, and that really hasn't changed, and 6% are African American, and that hasn't changed in 3 decades, how do we think we're going to change this? Well, we can do that. First of all, doctors have to be educated on the social determinants of health. We have to get into the communities. We have to be in those communities. It's not a matter of, I have a 1 day a week clinic there that I might volunteer. It's getting to know your community. It's visiting people in their homes. It's understanding the realities. It's taking a kid that comes from a family that makes $500,000 a year. Understand that, no, not everybody can get a colonoscopy. They have neither the money or the insurance. And when you're an hourly employee, to go see the doctor, that means you make 20% less, plus what you pay for transportation, plus the doctor's visit, and then all the things that the doctor orders. And if you live in the state of Florida, where it's now that you have to declare your residency or immigration status when you go to the hospital, it's bad enough that they couldn't go there because they couldn't afford it. Now they can't go there because they're afraid they're going to be deported. This is very similar to Proposition 187 that happened when Wilson was the governor of California. How do we change this? From my perspective, we start off with medical education. This is the second medical school we start. The first one we started was Florida International University, where we became the first medical school in North America to actually teach social determinants, but embed our students in the community. We ended up with 70% of our students only got into our school. 35% were first generation. We were the second most diverse medical school in the United States of America, with 55% of our students being underrepresented minorities. Of that, generally 35 to 40 were Hispanic. The others were African American, and trying to represent what Florida looked like. However, every graduating class we had, they had the highest USLME Step 1 and Step 2 scores in the entire state of Florida. We became the only medical school in Florida that actually matched 100% ophthalmology, urology, neurosurgery. These are very competitive programs to get into. One of the things that people like to say is we need more minority physicians to work in minority areas. I'm a bit opposed to that. We need more minority physicians because it represents our country. It is the right thing to do. And we're throwing away talent. If 70% of your students get into only one school, but yet they get the highest scores when they graduate, we have to relook at admissions and how we bring students in. What are our criteria? What do we need to do? And that becomes very, very important. What we're doing out here at our new school is I'm targeting first generation students. Why am I doing that? Because they tend to come home. Plus, it offers now the first person in that family the opportunity to earn generational wealth, something that education gives to everybody. We need to relook at education. We need to change education. We definitely need to develop a system that takes care of everybody in this country, regardless of anything, without prejudice. They're human beings. You take care of them. And, one of the things that's important is if we don't address the social determinants, we're not going to get there. And one of the most important social determinants that we're not addressing is called trust. Is being able to have somebody trust us so that we can take care of them. The trust in the healthcare system in the United States has nosedived. In 1975, it was 83%. And in 2022, it dropped down to 35%. So it's just not the Hispanic population, it's the entire country. We as a profession are many times looked at as individuals with gross conflicts of interest, where the economy and how much money we make supersedes our oath. We have to get back to the basics of who we are. And if we weren't there, then we got to get there. We have to teach the virtues by example. We have to turn around and say everybody without prejudice is eligible for care. But most importantly, look at your local laws that are being changed. Look at your social policies. Look at your public policies. Do you have the appropriate housing policies? Are people being paid a living wage? Do they have transportation? Not getting from point A to point B, but getting there conveniently. If you got to take 4 buses to get to the doctor, then you have hypertension. I guarantee you it's going to be high when you show up at the clinic. We have to have accessibility. We have to have diversity. We have to bring everybody to the table. And we have to realize that we as a profession have really not done it that well. Look at the health outcomes of this country. Sure, we got a lot of patents, but we have a lot of suffering. Hispanics are living a little longer, but we're living longer sicker with comorbid diseases that extend from all the chronic illnesses you can imagine to higher rates of dementia. And I don't know if anybody knows this, but Rand did a study a few years back that showed that we spend more money on dementia than we do on heart and cancer care in this country, an average of $95,000 a year. That's many times twice what a family will make when they're lower socioeconomic. So either we change the social and public policy, or we quit talking about health equity for my profession. And, you know, I'm one of 4 Cuban Democrats. We meet in a phone booth on 8th Street. It's really quiet. But I think all the physicians are going to have to change their parties. So they look at this and say, we really, truly want health equity. It's not about what I make. It's about how many people's lives I touch, which is exactly what Hispanic Heritage does. The number of lives that you touch becomes so important, especially in this era of social media and everything else. We have to get back to being personal. We have to get back to discuss. When it comes to mental health, talk to somebody, a family member. Talk to your best friend. Talk to your partner. Talk to your parents or talk to your children. The conversation has to be open, because if not, you're not going to get better. And we need everybody better. Why do we need everybody better? Because it makes a better country and a better world. And it gives you the opportunity to do what you need to do. Like I said at the beginning, Tony, you, AARP, you guys do so much more for health in this country than we in medicine do. We're here to deal with the consequences of having inappropriate social and public policies. Your zip code is more important than your genetic code to dictate how long and how well you would live.
Thank you so much, Joe. Really appreciate it. And I just have to tell you, as somebody that is always representing the truth and always in an authentic way, I just thank you for just serving as that beacon that we can all follow in terms of staying close to this service industry that we're all in, including the healthcare profession. If you would like to learn more about Dr. Greer's inspirational journey and his ongoing fight for healthcare equity, please listen to the Fritanga podcast, which will show up in the chat box in a minute. Again, Joe, thank you. You always bring it. And now I will hand it over to Jessica Herrera from HHF to introduce the rest of the Charla Oradores. And thank you, Jessica, for always being here, and appreciate it. Take it away.
Thank you, Antonio. And as you mentioned, we have a great lineup of speakers joining us today. So let's get started. Joining us next, we have Rafael Campos from Washington, D.C., who is a Deputy Director of Public Engagement at the Office of the Surgeon General, U.S. Department of Health and Human Services. Thank you so much for joining us, Rafael.
Thank you so much, Jessica. And I appreciate the opportunity to be here and speak with everyone about the work that we've been doing here at the Office of the Surgeon General to improve mental health and well-being. Go ahead and change the slide. So the Office of the Surgeon General, I have the pleasure of working with Dr. Vivek Murthy, who is a Miami native And he's the 21st Surgeon General, but was actually also the 19th U.S. Surgeon General, serving both in the Obama administration as well as the Biden administration. So the Office of the Surgeon General, simply put, is a communication platform to share pertinent public health information to the public. The levers that we utilize to do that are through public events, public speaking, reports, and engaging with stakeholders and folks in the public. My role specifically in the Division of Public Engagement here at the Office of the Surgeon General really focuses on planning a lot of those trips, staffing the Surgeon General at the White House and at other locations, rolling out a lot of the reports and making sure that they're successful and folks are actually reading them, and then realizing a lot of the recommendations that are included in the reports that we create. So next slide. So I really want to spend the bulk of my time talking about protecting youth mental health, which was a advisory that our office had created and released in December of 2021. And the document itself is really a roadmap or a blueprint for how several sectors can best engage to address the youth mental health issues that they are seeing in their communities. And whereas we have a science team that was working with subject matter experts to ensure that with evidence-based best practices that can be scaled across communities, one of the joys that I had with this report was really facilitating close to 30 listening sessions with young people of various ethnic backgrounds to ensure that, yes, we were hearing from subject matter experts and we were taking account of what we could be doing. But we also wanted to hear from young people directly. You don't want to put a report out about young people without speaking to young people and hearing their voices and making sure that that anecdotal evidence was also included and reviewed with the same rigor to ensure that the recommendations that we create actually have legs and that they're actually going to help support the communities that we hope to improve. So next slide. We're sharing the presentation, so there are links available that could send you to the document. I'm not going to go over all of the content covered here. This is just a brief overview, but some of the main takeaways, I would say, or some of the examples that I'd like to pull from here are specifically with parents. You know, some of the main things that we really talk about in the advisory are improving the relationship among young people and their parents and their caregivers or their grandparents, or and identifying warning signs so they know what to look for so that they can help folks seek help afterwards. With schools specifically, really focusing on expanding social emotional learning programs, empowering schools to help parents enroll students into programs like Medicaid so that they can receive the behavioral health services that they need. And with community-based organizations specifically, it's really advocating for more youth enrichment mentoring programs, but also encouraging young people to be peer supporters so that young people are being cared for by other young people, especially given that we have a shortage of mental health professionals across the country. Next slide. So the advisory is a bit of the what. I would say my job really comes into play, emphasizing the how. So we get all of these recommendations. What do we do with it now? So this is one example of an event that we planned with the White House, the First Lady's office, and Selena Gomez's team. We uplifted 18 brilliant young people doing great work to address mental health in their communities. For example, Jorge Alvarez, a Rutgers graduate, is doing really great work on social media to leverage his platform to destigmatize mental health and connect folks to mental health services in their communities. And he's doing that through Active Minds. But it's just an example of really trying to uplift a diverse group of folks who are doing great work in this space and to give them a platform to tell their stories in a compelling way that best resonates with the American public. Next slide. This is a youth mental health summit that was organized by the California Endowment. They brought together young people, community-based organizations, representatives from Governor Gavin Newsom's team, who had committed a historic, I believe it was just above $4 billion to address youth mental health. And they were inspired by the advisory, created this awesome summit to bring folks together to inform the governor's team on how they could best allocate some of that funding to address youth mental health in the state. And we were invited there to help share what we learned through our travels. And to go to my last slide, What I love about the pictures on the last slide are before we released or immediately after we released the Youth Mental Health Report, the Surgeon General went to South by Southwest in Texas, and we convened a group of 20 mayors for a 3-hour session to talk about youth mental health. So just think of that. We had 20 mayors working together, learning from one another, supporting one another to think creatively around how we could best address the mental health crisis that we're seeing. And I think this is an example of where engagement comes into play to take the recommendations that are evidence-based, but to really try to realize them in communities to make a difference. So I'll switch to my last slide and just say thank you. My email address is there. Please feel free to reach out, but appreciate AARP and the Hispanic Heritage Foundation for inviting me to share.
No, thank you so much, Rafael, for joining us and for all the work that you and the Surgeon General's office is doing on the youth mental health. We'll make sure to share those resources that you listed there to the audience so they can be active and take advantage of that. Moving on to our next speaker, we will now hear from Dr. Ana Sierra from Washington, D.C., who is founder and executive director of Ana Sierra Counseling. Take it away, Dr. Sierra.
Good afternoon, everyone, and thank you for having me here and in this space. Just a little bit of an introduction. We do have a private practice here. We are the first all Latinx bicultural bilingual practice in Washington, D.C. So we provide, pro bono services, low cost, and also special services for our immigrant population. And also co-founder of the Latina Healing Institute, which I'll talk to you a little bit about as the presentation goes through some of the data in regards to mental health and the realities that are coming up for us as therapists in the field. You can go on the next slide. So this is not a surprise to all of us that we are well aware that Latinos are growing really fast in this context. And by 2060, it is expected that we will grow 28.6%. So this is amazing because now we can see some people that, here and there representing us in spaces that we need to be represented on. And it's exciting to see the growth. Now, the challenge for us now is that, if you can go on the next slide, going back to how we identify ourselves, right, as Latinos, there is a lot of confusion in the literature of mental health on how we are naming ourselves and how we are being identified. So if you look at all these identities, and we are not even combining the indigenous Afro-descendant identities or European identities, Asian identities that go into being Latino, so the whole race aspect. We are pretty much down to our ethnic background when they talk about Latinos in the mental health literature. You can go on the next slide. The problem is here that according to the American Counseling Association, only 6.3% of therapists are Spanish speaking or consider or will say that they are Latino, Latina, Hispanic, which is like the least number that of people that we have in these spaces representing, but also treating our people. The reason why this is happening is because we're not that we're not going to these spaces, but we know that there are barriers to our people going back into school or going into higher education. But another aspect of this is that in the literature also, they don't study how we heal, how we get better, right? Because 90% of that research is conducted in Western, educated, industrialized, rich, and democratic societies, which in the literature is called weird societies. And the problem with this is that we are not seeing how else do people out there heal. So we only know that this represents 12% of the world's population. So not even just for Latinos, but everywhere across the board. Our counseling practices at this point are great, they're effective, but not always as effective because they come from that focus of that westernized worldview, right? You can go on the next slide. So these are some of the ways that we care for our Latinx clients in the world of, self-care, well-being, mental health, wellness. And I wanted to talk about this concept of self-care. Everyone here might be familiar with that word. It's a buzzword, it's viral. Everybody talks about taking care of yourself. But you just know that in our Latino community, self-care has a different worldview of how it's done. So it is great if you want to get up in the morning on your own and put on your running shoes and get some exercise. That's amazing. But self-care for us means that you don't have to do it on your own. You can also have community. You can have check-ins, accountability buddies. So if you are having troubles with self-care, it is well known that we are better at it when we're connected to somebody else about this. So sharing a goal with a friend, a neighbor, somebody that you care about. But just that note about self-care. So the worldview on how we heal is important because that's how we retain and we create those habits that stay for a longer time than other things that may or may not work. There's individual therapy. There are over 10 main theories, and under these main theories, there are like hundreds of sub-theories. So whenever you're doing your research to take care of yourself and finding a therapist, it is really important to research these things, be informed, ask questions. You have the right to interview us as therapists. How long have you been doing this? What licenses do you hold? How can you help me with this particular problem? Make sure you become that involved in your own well-being when you are investing your time in the therapist space. Also, finding a Latinx counselor may be really hard at this time because we are the least represented in the field. We have family-centered interventions and community care, but I wanted to talk about just particularly our immigrant population. We provide special care for our immigrant population because there's a lot of research on our community that because of the amount of stress that being undocumented causes to a person's well-being, the type of treatment has to be different for people who are not documented. It doesn't matter if they are trying to fit into a society, but knowing that you could be deported at some point, anytime, it is a huge risk factor for mental health. If you can go on to the next space, and if you have any questions, you can ask. So we developed this project called the Latina Healing Institute for anyone that self-identifies as Latina. It is a community of a Latina-led space, healing space for high-achieving Latinas. And we don't talk about the stress that comes for a Latina that is dealing with layers of oppression in spaces, even when there are other men of color in spaces of power, even when there are other people of color in spaces of power. So spaces like this are going to become something that is more common among our healing spaces as therapists. Why? Because this helps us do a lot more of that community-based healing. That has not been studied so much in our literature because it is not the focus of how research is done with Latino and patients. So looking at how we connect to others, how we are able to heal things that we all are aware of, intergenerational trauma, family, dynamics that are different than other cultures. This is what is really going to be the next step for us as therapists, as Latinx therapists, to be able to serve the amount of need that's going to be coming up as we grow in numbers. Because even as of right now, there are not many of us, but if we think about 2030, we are going to be in a huge deficit problem here. But yes, I invite you to look at spaces of healing that are community-based, but also research the way that you want to heal. I'm happy to answer any questions, and let me know if you need to contact me later and let us know, and we'll be able to help you here. You can go on the next slide, and I'll leave you some resources so that you could go into more deeper identity self-search. If you can go on the next slide and the next slide, I think that those are some reading recommendations. Next slide are some other recommendations for resources. Because knowing ourselves and knowing our people, knowing how we heal, it is the most powerful tool you can give to yourself. Thank you.
Thank you so much, Dr. Sierra, for the work on mental health and for sharing all those resources. Like I mentioned, we will be sharing those in a follow-up email. And I want to highlight and commend you for the services you provide to our migrant community. We'll make sure to connect you with anyone that reaches out if they have any questions or would like to be connected with you. So up next, we have Colin Gonzalez Tapley, who is a freshman at Johns Hopkins University. Thank you for joining us, Colin, and take it away.
Hello, thank you so much for having me on. It's truly an honor to be heard here. Today, I wanted to take this opportunity to talk about a specific niche of public health that I really feel passionate about. So public health is often hard to see from an average person's perspective. If you're just going out on the street, you are going to be unaware of the inequities that Dr. Gria and others are talking about that are within this field. You will not be able to see it just from your surroundings. These inequities are readily apparent in this field I want to talk about, organ donation, where thousands of lives are lost each year because of these inequities. So organ donation, for those who don't know, is either deceased donation or a live donation. If you consent to having your organs donated, they will be, after you die, a certain percent of people die in a way that their organs can be harvested and then given to somebody who needs them, either saving their lives or at least very much improving their lives and their general livelihood. There's a shortage of available organs that is in the hundreds of thousands for people. People die every single day waiting for an organ. And this death is not equal among different people. Minorities especially suffer far more, and far more deaths exist as people wait for donors. The life of somebody waiting for an organ donor is often painful, costly, and even if you can survive without the organ, such as a kidney, your life expectancy will lower greatly. So every additional organ that is donated is a life saved, or at least incredibly improved. It is a life that is changed forever. It's absolutely just life and death. This is a huge opportunity to save lives, so I want to talk about specific parts of this field. So some of the reasons that minorities are far more likely to need an organ donation is because they have much higher rates of diseases that affect the heart, liver, kidney, lungs, and other areas. Unfortunately, they are much less likely to receive these organs. This is due to two main things. The first is that compatibility is largely based on race, as it is ideal to have a donor and recipient who are genetically similar. However, due to ineducation and misinformation, minorities are less likely to be organ donors. Like Dr. Greer was talking about, their trust in the profession is crucial. Not a huge problem is that there's a mistrust in the people who harvest organs, and that they are going to possibly, if you say you're going to be an organ donor, they're not going to work as hard to save your life. This is completely untrue, but there really needs to be a gap bridged, a connection reformed between the doctors and the patients to establish that trust and to help these people become organ donors. Tragically, only about 35% of all recovered organs come from non-white patients, even though people of color make up 60% of people on the waiting list. That means the waiting times of people of color are almost double the times of a white person's wait on the list would be. The second reason for inequities in this field is the level of subjectivity within the fields. The management for the field is not the greatest. Since there is a far greater demand for transplantable organs than there is a supply of them, transplant centers must come up with difficult choices about which of their patients will make the waiting list. This process, unfortunately, is not at all objective. Studies have shown that individuals' implicit biases strongly impacted who makes it on the list and who doesn't. And of course, this hurts minorities getting on the list. Once minorities are on the list, they are still much less likely to get the organs that they need. Organ procurement organizations, the organizations that are in charge of giving the organs to the people who need them, do not act as one, but improvements in these specific organizations and policy changes to help boost donations, especially minority areas, have shown there's so much room for improvement in the field. These organizations need to focus on better serving their communities of color. A person's ethnicity should not determine how likely they are to receive an organ that they need to survive. The organ procurement organizations must be improved to address these inequities that prevent thousands of people of color from receiving the organs they so desperately need. We need to represent America for what it is, and it is especially important in the field of public health. Non-equal representation is a matter of life and death. Minorities die and will continue to die because of unequal representation. Diversification in these fields is absolutely crucial. It is mind-blowing to me that there's such an opportunity to save human life that is not being taken. Whoever you are, you can help in any way possible. It absolutely matters. Whether you lobby to our legislative branch to improve the system, or just by convincing the people around you, you are helping to save lives. Every step in the right direction counts, which is oftentimes hard to see with such large goals. There's so many opportunities in public health fields that countless lives can be saved. And it's hard to see, just like in the mental health area, it's hard to see, but there are opportunities to save so many lives. Personally, I'm planning to start a club at my university that I attend next year, and I seek every opportunity such as this one to spread this message. I bother my friends about this all the time, and I was a teaching assistant for a freshman class, and I know that they, as soon as they become drivers, they have an opportunity to opt into organ donation. So I just bothered that class as well by taking the opportunity to tell my message to them and tell them to hopefully convince them to become organ donators. Because even if I just convince one person and then that person becomes an organ donor and their organs get donated, how that influences how that influences everybody else and spreads the ripples of life. It can go on and on. There's no telling how far those ripples can go. To end my presentation, I would like to talk about the influence Tony Chihurino has had on me. I've had the privilege of being friends with him, as well as his eldest daughter, Mercedes. And Tony has been such a huge influence on my life. He's the reason I'm here today. I learned from Tony that the key part of whatever you set your mind to is action. Not just talking to yourself about it, but if you have these ideas up here, you might as well just talk to other people about it. Start by spreading it to other people around you, even if you don't know what you're doing. This can help you spread your message. And Tony has done that to me, and other people have done that to me as well. He has taught me to keep striving and to find unique opportunities to help our community and the world. The opportunities to do what no one else has done are available. They are within reach. And every single positive forward step counts to make a better, more equitable future. Thank you guys for your time. I really appreciate the attention and everybody listening to me. Please don't hesitate to reach out in the chat and for any questions or advice you have for me. Thank you.
Thank you so much, Colin, for joining us. We look forward to supporting your work in the field and building that bridge with our community and that misconception and becoming an organ donor. So thank you so much for joining us and sharing that with us today. Up next, we have Dr. Elian Shapiro from Los Angeles, California, who is a Chief Health Correspondent and Medical Affairs Officer at Latinx Health Services. Thank you for joining us today, Dr. Shapiro, and take it away.
Jessica, it's a pleasure. And familia, I'm a doctor. I have been out there. I come from a small city called Mexico City. And I have the pleasure right now to serve in Latinx Health Centers, that it's one of the largest fair qualified health centers in the country. And we cater around 400,000 souls. I can tell you for sure that the job that I do every day, it's important. And when I talk to my parents, my kids, everybody around me, And I let them know, like eat healthy, go out there and do exercise. At one point of my life, I thought that my patients were having trouble understanding. Maybe it was my accent with a jalapeno from Mexico. I didn't understand specifically what was actually happening. But in reality is that the miracles of transformation do not happen inside of a clinic. The clinic is the Band-Aid. But right now, we need to talk about what's the magic and who can actually achieve it at the moment that they leave our clinics, our hospitals, our walls. Because I was telling them, eat healthy. It sounds great. It's on all the books that they taught me, that the ones that I wrote, like eat vegetables. But if you're living in a fixed income, or you simply do not have the economical power to buy vegetables, and you end up eating high caloric foods. And at the same time, I tell you, like, go run out there, but it's completely unsafe for your kids to go to the park. Well, the books are not translated to the real world that a lot of my patients are living. Then we need to figure out how can we translate that. And one of the things that we have done in the past years is making sure that our voices are heard. Why? Because if you're not on the table, we are the main dish. Representation has a powerful thing, and you will go like, what the hell is a doctor talking about representation? Well, if I really want to fix diabetes, if I really want to fix my patients that come with anxiety, depression, with something that you will start hearing a lot, that it's called adverse childhood events, that are those things that are marking your life, from violence in your house, lack of food, lack of stability of a roof on top of you. All of those things are little cuts in your soul that parents actually are carrying them, and the kids are carrying it too. Interestingly, it becomes something called toxic stress. And toxic stress, it's completely different than the regular stress. We can be stressed and we can have that feeling of survival when we have like a lion behind us, when we have like a shark and we are swimming fast and we are actually chasing and moving forward. That's good stress because we're moving. An exam, that's good stress. But if at every corner in your life, you feel that there's a shark, there's a tiger, like a lot of our familias are having, that's toxic stress. That means that the brain starts actually changing. The way that you think starts to change. And it's not only the mental health, but it actually translates to diabetes. It's actually translated to heart attacks. It translates to high blood pressure or even very, very unhealthy addictions. Then at this moment, with all these dots that we have out there, if we have been hearing consistently on these conversations that there's a lot of things there that have been negative for our community. But let me tell you a couple of things. If I tell you right now, if you can actually conjoin a lot of countries and we can actually compare the GDP, will you think that who will be actually the fifth largest GDP of the world? Familia? Those are the Hispanos. If you conjoin all the Hispanos in the US, that will be the fifth largest GDP of the world. It's actually published on UCLA with Dr. Hayes Bautista. And let me change a couple of other things. Then that means that we're not that pobrecitos. We have something. And with absolutely everything that we have had, that, our zip code is actually decremental. And we do have more asthma, and we have more diabetes, we have high blood pressure and everything else. But there's a secret sauce between us in the community. It could be la abuelita, and maybe it could be tequila. I do not know. But most importantly, it's things that we have around us that are making us change and be present and be consistent and be resilient. Then at the moment that we're connecting all the dots from the clinic, and we bring a promotora, a healthcare promoter, a community worker, and they go to their home and they see where they have, and actually they connect the resources with food pantries, and we actually do like SNAP, and we start connecting the resources to actually amplify the health of the community and actually walk together in safe spaces. We start changing the rhetoric that we're not just pobrecitos. We are in a resilient, amazing community that it's here and creating. And we need to start creating for the future of our kids. Sadly, right now, less than 6% of all physicians in the US are Hispanos. 2% of that 6%, meaning 4% are males and 2% are females. Then when you put that in context of the amount of people that we have there, just here in California, for the amount of Latino physicians that we're creating, it will take us 500 years. 500 years. I would not be here for sure to actually get a balanced level of doctors. And it's kind of the same tendency with nurses and dentists and healthcare providers, mental health specialists. Then we have a lot of work to do. A lot of work to do. We need to be innovative. We need to be there. And most importantly, we need to make sure that we're gearing up to be represented. If you're not going out there and you're not talking with your local representatives, that a lot of the traction and things that we have in our communities are dependent on what's happening in our neighborhood, in our zip code. That's kind of the basic things that we have, that we can do. Then if I want to tell my patient next time, eat healthy, that's important. If I want to connect them with mental health resources, that's extremely important. I want to talk to them in a language and the cultural aspect of it that is appropriate. That way we can connect and be present. And most importantly, I'm going to ask them if they're registered to vote. That way we can actually start touching us as healthcare providers. And that's a nurse, that's a dentist, that's a doctor, that's an MA, that's a nurse practitioner, that's a mental health provider. That's all the promotoras and promoters that I love to be together and going above and beyond what the books tells us to tell and say and act upon, and moving forward to the reality of our community, to a shiny, amazing community that has strong will, resiliency, the secret sauce of familia, and a lot of things to continue giving and making sure that we are going to create a better future for our children. Then I will be leaving my information on the chat over here. And from my heart, Tony, I see you over there. Thank you so much. I was checking the last time that we talked to each other. It was 2021. Then that was the last time that we were together. Then muchísimas gracias por la invitación.
Thank you so much, Dr. Shapiro, for joining us. We really appreciate it. And we'll make sure to share your contact information as well after this, so folks can connect with you. We will now hear from Jaime Martinez from Pittsburgh, Pennsylvania, who is a community advocate and a student at Johns Hopkins University. Thank you for joining us, Jaime. Take it away.
Thank you so much, Jessica. And thank you to everyone on this call. Good afternoon. My name is Jaime Martinez. I'm a senior at Johns Hopkins University studying public health and international studies. And I'm also a Pittsburgh-based community advocate. I'm also the founder of a coalition known as North Allegheny for Change, or NA for Change for short. It's a Pittsburgh-based grassroots coalition of students, alumni, parents, educators, and community members founded 3 years ago that are working to place the issues of DEI and anti-racism at the forefront of our community's attention while advocating for policy solutions that benefit the community and its students. And as Tony says, I'm also Nicaragüense. That's right. I love me nacatamales. So I want to thank the Hispanic Heritage Foundation and AARP for the privilege to speak here today. I'm so excited to add context to this important conversation surrounding the health of our Latino community. And I want to start with an acknowledgement of the past few years that we've lived through and a recognition that we need to enter these conversations, especially when we talk about young people, with a mindset different than the one that we did years ago. So during COVID, students of color are much less likely to experience in-person school, with only around 35% of Black and Latino students and about 18% of Asian students enrolled in full-time in-person instruction, compared to almost 60% of white students. Not to mention various technology barriers, which also affected students in low-income households in rural areas. And we can't forget about students learning English that had reduced access to resources and face-to-face interactions and individualized instructions, right? So with students returning to school and suffering from immense learning loss and with a lack of socialization that we as young people have had over the past few years because of the pandemic, and with the failure of school boards and school administrators to address learning loss in a very serious way, you start to see that negative outcomes have been amplified for the Latino community. What becomes a rain shower for one community is a hurricane for us, and it has devastating consequences. And due to that, there are disparities in access to mental health services for Latinos. You know, Latinos bring a happy, vibrant culture and incredible talents to our super diverse society. But when it comes to mental health, we face pretty tall, although not insurmountable barriers, right? Language and cultural obstacles slam the door shut on much needed support. Spanish-speaking Latinos struggle to access mental health services primarily offered in English, which creates misunderstandings with communication that hinders proper diagnosis and prevents quality care. And of course, something that we all talk about is the stigma that suffocates mental health discussions within our communities, which leaves individuals silenced and suffering in silence. So how do we begin to address something like this? So as a background, I'm a public health guy and I love public health, and I go to Johns Hopkins and I love the research aspect, but I also love education policy, and I'm actually running for school board right now. So that's like my whole other bread and butter. So this is sort of where that's going. But as Dr. Greer stated at the beginning, social and public policy is the strongest tool that we can use to address the mental health crisis that we see within the Latino community and also within schools. So as Mr. Campos from the Office of the Surgeon General stated, expanding social emotional learning programs is really important. Funding mental health services directly in schools provides the ability for students to have access to resources during the school day, and that's groundbreaking. Reaching out to community organizations to facilitate this and to facilitate equity in this respect while having their ears on the ground and their hearts and hands in the community also provides a lot of insight and help to schools. In addition, we have to provide educators with cultural competency training and mental health professionals, obviously, as well, in order to recognize the unique ways that different communities respond to mental health struggles. It goes without saying, but understanding our unique experiences, values, and backgrounds is vital to providing support that is sensitive to our needs. We also need safe spaces within schools for open conversations on mental health, where students can seek support and feel a sense of belonging. And that's a good segue, because I really believe that there's both a need within our schools to change a stigmatizing culture, and also within our families and communities to create space for destigmatizing conversations. We need schools to foster inclusivity and diversity, where Latino students feel heard, respected, and supported in their mental health journey as well as their educational journey. We need to see Latinos, such as the changemakers that are on this call right now, represented in curriculums and in the media. And this is a lot of the work that the Hispanic Heritage Foundation has been pursuing to great success. An example of this is like Encanto, right? The Disney movie that came out a few years ago. If you read into it a little bit, it's actually a pretty crazy narrative about intergenerational trauma within Latino communities. And there's a lot that we can learn from there, and it creates accessible touch points for communities like ours. In addition, we also need to be organizing support from the very grassroots. So my coalition encourages students to come forward at every one of our local school board meetings, and we've been doing it for the past 3 years to speak out on the things that they care about. And for Hispanic Heritage Month, one of them spoke the following, and so I'm going to read it to you. They said, representation and integration at school allows us to feel seen as more than just a voting bloc, and it allows us to feel as an integrated aspect of American culture, since we all aspire for the United States to be like a quilt, each patch unique and integrated into the greater whole. So this generation of young people and their mentors are literally doing the work right now to change their community. As I think Tony stated earlier, my involvement with the youth awardees in the Hispanic Heritage Foundation and through the Loft Institute has really shown to me how Latinos in the United States, not just in Pittsburgh or in Baltimore where I go to school, but way beyond, are involving ourselves in our communities and creating solutions that really work for us all. And most importantly, allow for the most marginalized in our community to take ownership over initiatives that are brought into our spaces. So a few of us have been talking about the bird's eye view and the need to invest in funding for our communities, but I want to emphasize that we need to not forget the hyperlocal as well. We have to keep on keeping on in this respect and keep our ears and our hearts on the ground on the most micro level. And with that, we talk about our families, right? So according to the Anxiety and Depression Association of America, only 20% of Latinos experiencing mental health issues ever speak to their doctors about their symptoms. Worse still is that only 10% actually seek out help from a mental health practitioner. So my take on this is that we all have a duty within ourselves to lead these conversations within our own families, guided by the work that community organizations and advocates are doing, armed with knowledge, and most importantly, driven by a relentless sense of empathy. Something that I've talked a lot about with my friends and in the other places I've spoken at over the past few weeks and months is that everything is relational. Everything goes back to relationships, and everything goes back to the idea of community. Faith is grounded in a sense of community. Citizenship is grounded in a sense of community. Our purpose should be grounded in a sense of community. And as Latinos, arguably no one does community better than us. So I have a lot of confidence in our future, and we just need to get after it. Thank you all for your time, attention, and for the opportunity. I appreciate it.
Thank you so much, Jaime, and suerte on your campaign. And you are the leaders of today, as Antonio mentions, on and on again. And so you're already a leader by the work that you're doing. And thank you so much for joining us and sharing with our community today. Up next, we have Hector Araujo from Phoenix, Arizona, who is a community engagement manager at Unite Us. Take it away, Hector.
Hey, buenas tardes. Thank you so much, Jessica, Antonio, Hispanic Heritage Foundation team, everybody on here. Also, Dr. Greer, thank you so much for being here. And my fellow co-board member, Dr. Shapiro, so nice to have an opportunity to follow you, good sir, and all the great work. And so team, I know we're a little over time, so I'm going to move through this as efficiently and quickly as I can, team. So I just wanted to share a little bit about and build on what everyone has shared today, but most importantly, share some of the solutions that we're implementing in community around some of the topics that we're talking about. And so as Jessica mentioned and introduced me, my name is Hector Araujo. I am a community engagement manager here in the state of Arizona. I work for a tech company called Unite Us, but we are partnered with the state of Arizona. I work directly with Access, which is the Arizona Medicaid program here in the state. And we focus specifically on connecting what we've been talking about here, healthcare and social care, working with the government agencies as well to help fund these initiatives. So what does that mean? What are we talking about here today? So specifically today, and to build on what we're all learning today, is I'm going to discuss specifically the social determinants of health and why focusing on them is crucial, as Dr. Greer kicked us off today. Additionally, I'm going to highlight just a little bit of these factors and the impact of the Latino community. So when we talk about health, team, the work that I've been doing here in the state and across the country is when we talk about health and think of health, a lot of folks, when I bring this subject up, they think of only healthcare systems, clinical services, doctor's offices, urgent care, or some of the panelists that are on with us here today are wonderful physicians in community. But we understand that the idea of health lives in the community, and that because we were all serving the same community, including the community-based organizations, part of that social healthcare, we all need to be at the same table as we're speaking about community itself. Andres, if you wouldn't mind going to the next slide, sir. So what are the social determinants of health? We keep talking about that and mentioning them, but what are they? The social determinants of health are the conditions in which we are born, live, learn, work, play, worship, and age, all that shapes our overall well-being. Now, these factors include income, education, employment, housing, social support, and access to healthcare. They are all critical in understanding health outcomes, and as Dr. Greer mentioned, often playing a larger role than individual behavior or genetics. So the social determinants of health in the Latino community, let's explore a little bit about how SDOH has an impact on health in the Latino community. First of all, let's look at education. Educational opportunities greatly affect health. Unfortunately, as we've learned here today via some of the statistics, Latinos face challenges such as language barriers, limited access to quality education, and lower graduation rates, which can lead to decreased health literacy and poorer health outcomes. And we were talking about income and employment. We know that financial stability is crucial for health. Antonio Tijerino mentioned in the chat about when a family has to choose whether getting a burger from McDonald's or an apple that's the same price, right? So Latinos on average experience lower wages, higher poverty rates, and limited job opportunities. These disparities contribute to the higher stress levels that Jaime was talking about and Dr. Shapiro was talking about, and also our limited access to healthcare and an increased risk of chronic diseases. And when we're looking at this spoke of the social determinants of health, housing in the neighborhoods in which we're living in and growing up in, Latinos often face overcrowded living conditions, inadequate housing, and limited access to safe recreational spaces. These factors can lead to physical and mental health issues, including respiratory problems and higher rates of violence. And some of our friends out there in DC with the fires in Canada, y'all know what I'm talking about. If you don't have an ability to stay safe and indoors, you are then exposed to the elements as well. And then lastly, the access to healthcare. Latinos experience disparities in healthcare access due to a various amount of factors, including language barriers, immigration status, and lack of health insurance coverage. Limited access to healthcare hinders early detection and timely treatment and preventative care. And so here, next team, what we have is what we focus on here in the program here in the state of Arizona, what we call the Community Cares Program in partnership with Access. So as Dr. Greer mentioned, as Dr. Shapiro mentioned, we call it the Whole Person Care Initiative here in the state of Arizona. And this is a policy that we passed in 2019, funded fully by the state of Arizona. Now imagine that when the government, community-based organizations, and health entities come together to look at the holistic care of our communities and the people within our communities. And a little bit about this initiative, what you can see here, we focus on all these prongs here. So my goal in prevention is to make sure that our patients and community members only go see Dr. Greer and Dr. Shapiro on their terms, not when it's too late or because they already have specific ailments or health concerns or issues. We want to make sure that we are working with folks to provide these wraparound services before it ever gets to a chronic illness or something that can be a co-occurring need in the life of somebody. And so this is a little bit around the Community Cares Initiative team. My job here in the state of Arizona is to bring together all community-based organizations, which, as Dr. Greer alluded to in his opening statement, you can't take 4 different buses to get to the doctor's office every time you go, because we know that that's a challenge and a barrier to that access to healthcare. We understand that folks need access to proper education. They need access to proper housing and food and income opportunities, employment, legal services, and most importantly, that social support team. And so what I focus on here is onboarding community-based organizations onto these initiatives that cover each of these prongs. So I'm not necessarily going straight to physicians. I'm going to all folks and nonprofits in the state of Arizona that claim to provide a service to make sure that everyone has access to that service. And so our piece of technology is able to align those referrals for the Whole Person Care Initiative, and we can track all of those outcomes to make sure that there are positive outcomes, that when we refer folks for help, that they are receiving help in a timely manner, and that can be measured, and we can hold everyone responsible, as well as help inform where there are gaps, how those gaps are being filled, and if government needs to step in and help fund and scale some of these efforts and initiatives. And luckily here in the state of Arizona, I think we have a really neat case study that can be used across the country on how we can all work together and collaborate on these initiatives from healthcare, government, and our community-based organizations. So in conclusion, team, understanding the social determinants of health and their impact on the Latino community, but most importantly on all communities, is crucial for all of our well-beings and the optimization of our communities and our cities and states. By focusing on education, income, employment, and housing, and access to healthcare, we can work towards a more equitable and healthier future. So I challenge you all and implore you all to let's commit to continue raising awareness, engaging in advocacy efforts, and supporting initiatives that promote health equity within the Latino community. I know that together we can build a society where everyone has an opportunity to thrive and has access to the resources that they need to live their most optimal self. And just so you're all aware, our platform does exist in 45 states across the country. So if anyone is interested in learning about our platform, it is fully funded by the states. So please reach out. But most importantly, thank you all so much for being here and for sharing all the wonderful information today. Antonio and HHF, thank you so much for the opportunity.
No, thank you for joining us, Hector. It's always great to have you. And thank you so much for the work you're doing in Arizona through the Community Cares program. It is important to reach our community in a timely manner. So we'll make sure to share these resources to our network after this charla in an email. And for our final speaker, we have Gabe Albornoz, council member at Montgomery County. It's a pleasure to have you, Gabe. Please take it away.
Thank you so much, Jessica. Thank you. And hola, buena gente. Thank you, Antonio Tijerino, for your incredible leadership. And thank you, AARP. I've had the opportunity to observe a number of the charlas that you have helped make possible, and each of them have been incredibly important and impressive. And I'm honored to have joined this remarkable group of panelists here today. And I'm so happy I went after Hector because he gave some excellent examples of what's happening at the state level to really improve overall public health, which dovetails nicely on what's happening at the local level here in our community. By way of background, I am the first at-large member of the county council who is Latino, and I chair the county's Health and Human Services Committee. And before this job, I was the county's director of the Department of Recreation, where we significantly expanded programs, particularly targeted to Latino youth and seniors and people with disabilities. And I want to share a very, very, very quick story and then give some examples of what we are doing successfully here in Montgomery County, but I think this provides some context. Hector and Dr. Greer mentioned the importance of public-private partnerships, and we were able to execute that very effectively during COVID. There was a 2-month period during the height of COVID before vaccinations were available, where over that 2-month period, 72% of the positive test cases were in our Latino community here in Montgomery County. Latinos only make up 20% of the overall population of Montgomery County. And although 3 of the top 10 most diverse small cities in the United States are here in Montgomery County, it was clear that our efforts were not working to reach the Latino community. And our Department of Health and Human Services recognized that their efforts were not working. And so then Councilmember Navarro and I convened a group of extraordinary leaders through an organization called the Latino Health Initiative and told them, let us know what you need and devise a plan to make sure we reach more Latinos, to educate them about the dangers of COVID and the importance of vaccinations once they became available. In less than 72 hours, they turned around a blueprint of a proposal that we were able to get funded. And flash forward 6 months later, after that proposal was initiated, and Latinos actually became the most populated vaccination demographic of all of Montgomery County, number 1. And it was because they went to the community. They didn't wait for the community to come to us. They understood and underscored that it's not enough to translate a document into Spanish and claim that you have somehow checked a box or have cultural humility. You have to engage the community where they are. You have to work with trusted individuals who are already making connections within that community and then empower them to reach the community even further. Those successes built a foundation and infrastructure that not only helped leverage the relationships we already had with health clinics such as the Mary Center and many others, but it also helped fund new and emerging organizations such as the Upcounty Food Hub, which was led by an extraordinary leader called Grace Rivera Oven, who saw a need in her community and engaged completely to be able to provide additional food security and services, further building trust, further connecting to other services that we have within the Department of Health and Human Services. So that story illustrates what's possible when we come together in an authentic way, listen to the community, empower them, and provide them with support financially. It made a world of difference, and I am sure saved many, many lives. Which takes me to what we are doing in the short, medium, and long term. And I will make this brief, I promise, because I know we are over. But in the short term, what we are doing is we are working to engage the community where they are. We have 4 supplemental health insurance programs here in Montgomery County. None of them require citizenship to be able to access. And so that has been a game changer. We are expanding mobile medical practices to meet the community where they are. And we're also expanding telehealth and telemedicine, which could have significant contributions if done well here in our community. In the medium term, we are partnering with existing health clinics and nonprofit organizations, but we are expanding that network to many other organizations in our community. And so we are identifying new and emerging organizations who may not have been previously funded by the county, but that need the support in order to be able to scale their programs in a way that makes a difference. And then finally, in the long term, we are being bold. We have announced just in the last 6 months that we have a plan in place to end childhood hunger in our community. And we know that this can be achieved, and that 40,000 kids right now in our community who don't know where their next meal is going to come from, that's unconscionable. And we have to address that moving forward. So those are just some of the efforts that we are tackling here in Montgomery County, and I'll leave you with 2 action steps. Number 1, get involved in local politics. I am proud to be a Latino member of the Montgomery County Council, and the emphasis that Councilmember Navarro and I have placed on this work is not an accident. Now we have a Councilmember, Natalie Fanny Gonzalez, who is outstanding, and all of my colleagues understand the importance of this work, but we have to have representation at local levels of government. So please engage, and please vote for Jaime if you can in his run for the Board of Education. And finally, engage, involve yourself in boards and commissions, reach out to your local elected officials, and be involved. So thank you all so much for this incredible opportunity. I'm so proud of HHF for continuing this great work, and I wish all of you nothing but the best. Muchísimas gracias.
Thank you so much, Gabe, for joining us and for the work that you're doing in our community. We are very honored to have you join us and share a little bit about the work that, not a little bit, all the work that you're doing in Montgomery County. So we have reached the end of today's Latinx Health Mind, Body, and Soul Charla. A big thank you to AARP for making this charla possible and numerous other charlas over the years. We do have our next charla focused on dinero, so stay tuned for more details. And a big thank you to all our speakers who were able to share their expertise, personal stories, and offer valuable resources. We will be sending an email out later with the charla link to rewatch, as well as the contact information and the resources that our speakers have shared today. Thank you all once again for joining us, and we hope to see everyone at our next charla. Have a great rest of your day and week. Hasta pronto.